just share my screen. How's that look? Is it showing up okay?
Yes, that's great. So go ahead. You've just slipped out of full.
Okay.
You're back in full screen mode.
It was going too smoothly. I had to mix it up a little bit.
Looks great.
Excellent. Okay. Well, thank you, Leon, for that introduction. And also thank you, Norb, and the entire MSU Chris team for the opportunity to present at this Science Symposium. NSF is happy to partner with MSU Chris as one of their non-governmental organization partners. You all heard from my colleague, Brad, earlier. And we look forward to participating in similar events moving forward. So again, my name is Sylvia Laman. I am an operations lead for NSF's Global Health Sciences Certification Program. And today I will discuss the strategy that we have derived for evaluating hemp-based products as dietary supplements. So just quick agenda, I'll give you guys an introduction to NSF. We will touch on our dietary supplement certification program, and then get into the meat of the presentation, which is our criteria for evaluating hemp-based ingredients as dietary supplements. So some of you may know NSF well, and Brad already gave a little bit of an introduction, so this maybe a little redundant, but NSF, we are a global leader in public health and safety. We recently celebrated our 75th anniversary in the public health realm, and in that entire 75 years, our mission has always remained the same in that we protect and improve human health. Over those 75 years, throughout our history, we're at a point now, we have nearly 3,000 global employees, including microbiologists, toxicologists, chemists, engineers, and environmental and public health professionals. Our expertise in certification and third-party testing is vital to many organizations around the world. We demonstrate compliance with national and international standards and regulations to demonstrate independent validation and verification to safety and quality standards. People all over the world, retailers, consumers, regulatory organizations, they rely on us to ensure that products, processes, services are safe, and we're protecting consumers. And so we specialize in a number of different services. First and foremost, we are a standards writing body. NSF has developed over 80 currently active voluntary ANSI standards. These are developed through a public process that ensures balanced input from industry representatives, public health regulatory officials, as well as users and consumer representatives. We have a robust global lab network that provides engineering, chemistry, microbiology, and toxicology lab and testing services. And again, those are global. We have lab operations in North America, Latin America, Europe, and Asia. Certification will be the topic of this presentation, so I will leave that until later. Auditing is a big component of a lot of our certification programs. We have a global network of auditors across different industries that are on site in the facilities, very thoroughly checking systems and processes. It's a unique situation right now in our current global state, and we've been quite nimble and identified processes for virtual audits to ensure that auditing isn't halting in the state of a pandemic. And in addition to that, we do also provide advisory and training. And the last little tidbit on NSF more broadly, because we are obviously having a virtual summit this year as opposed to meeting in person, I can't help but mention some of our COVID response related work. Won't go into them in detail here, but definitely check them out on our website for more information. All right, so I've talked enough about NSF. Now let's dive into dietary supplements. And so this pyramid here, and you'll notice I really like pictures and pyramids. This is the architecture of our dietary supplement certification program. And it's a tiered approach here. And so actually, Ricardo gave an excellent primer leading into this presentation, which really is founded in those regulatory requirements. And so the infrastructure of our program is founded in good manufacturing practices. And that's where our global network of auditors are on site in the facility, checking the systems and processes to ensure that they are compliant with 21 CFR 111. But the real focus of today's presentation is the next tier in our certification program, which is at the product level. And this is where we are confirming that the product says that it contains what it says it's going to contain. We address potential contamination, and also that the ingredients in the formulation are reasonably expected to be safe. And so just to add a little bit about our mark. So I mentioned that middle tier of the pyramid, that is our content certified program. And we have our standard on dietary supplements 173 and also a functional foods and beverage guideline. That top tier of the pyramid, we won't touch on in detail today. That represents our certified for sport program that is focused around ensuring that the products do not contain substances that are banned in sports. And we're not focusing on that today because current state is that products that are formulated with hemp or hemp-based ingredients are not eligible for that program. Okay, so getting into hemp. Why are we certifying hemp-based products? I think just reflecting on all of the talks both today and yesterday, it's obvious these products are ubiquitous. Consumers are using them. And at the same time, there is regulatory uncertainty. We're waiting on guidance from the FDA. There hasn't been a use level that the FDA has supported. So there's this giant gap. And as a public health and safety company, we saw this issue and our partners were asking us, what's NSF doing? How is NSF gonna lead a solution to this public health problem? And that's where we employed our network of experts to address this. Consumers deserve to have an option for products that are safe, that are free from contamination. And unfortunately, right now with the regulatory space, it's not obvious to consumers which products are safe and which are not in terms of hemp-based products. And again, just kind of highlighting what we do and why. We're perfectly poised with our auditing expertise, our experts in testing and evaluation, that as a public health and safety company, it is our duty to come up with a strategy to evaluate and certify hemp-based products. And so going into a little bit of the process of the program, we have first and foremost, as part of the product level review, an ingredient acceptability component. And again, I'm highlighting that 173 standard, that ANSI standard. And as part of that, NSF has established program policies to be considered an eligible product for certification to 173. And those two are outlined here below. So first and foremost, always confirm that all ingredients contained in certified products are in good regulatory standing based on country of sale. And secondly, that the ingredients in those products are reasonably expected to be safe. And as you all know, those two criteria become very complicated when we're talking about hemp-based products. So diving into regulatory status, I actually won't dive in because Ricardo did an excellent job providing a summary, but just reinforcing here that there are rules under the Federal Food, Drug, and Cosmetic Acts that for any product that's being labeled or marketed as a dietary supplement, and this is regardless if it's hemp or any other botanical or non-botanical, the product absolutely must be compliant with the regulations outlined in the Federal Food, Drug, and Cosmetic Act. And a little bit here too, if you'd like to dig further. So diving in a little bit to regulations, we took a focus in answering this question for regulatory standing based on country of sale, really focusing around definitions and where we can identify a category of hemp-based products that we feel has a place to be sold and distributed to consumers. As you all know, hemp is the plant cannabis sativa L, and the key differentiator between hemp and marijuana is that THC content. So hemp versus CBD, this is where we're really getting strict and disciplined around our nomenclature. Especially diving into this topic, I noticed right away that people were using these two terms interchangeably. And while there is some overlap, hemp and CBD really are two different things. And we really took that approach as we were evaluating the guidance that exists. And so with hemp, it is important to note that in December 2018, there were 3 hemp seed-derived food ingredients as generally recognized as safe. And Ricardo touched on that in his presentation. Those include whole hemp seed protein powder, and hemp seed oil. And so these GRAS conclusions, they do not affect the FDA's position on the addition of CBD and THC to food and dietary supplements. But there is a path forward for ingredients to be in dietary supplements if they are GRAS. And of course, CBD, this has been touched on consistently throughout all of these presentations, that FDA has concluded that THC and CBD products are excluded from the definition of a dietary ingredient. Though FDA has not provided great guidance as to what exactly that means. So we have hemp and we have the ingredients that are generally recognized as safe to be used in food. And then you have CBD referencing, of course, the Epidiolex drug that's been authorized. But we're challenging that there is a lot in between those two that deserves evaluation and consideration. And so in approaching this problem statement and really trying to leverage the foundation of what we do best at NSF, what we decided to do was to engage key industry experts via our standards development process. So as I've mentioned a couple times now, our certification program on that middle tier of the pyramid, the product level certification, is in accordance to the criteria outlined in 173. And all of the requirements in 173 are contingent on making it through the standards development process, which is incredibly rigorous, consensus-based, and comprised of experts across the industry. And so we decided to approach this problem statement the way that we know best, by going to our standards group. And in doing so, largely the entirety of 2019, my colleague Rebecca, she created a hemp task group under the 173 Joint Committee. And as part of that task group, we had representation and really enthusiastic participation from industry. Those organizations that were represented, some of them I've listed here, but really the point that I want to get across is that NSF did not approach this problem in a silo. We really wanted to make sure that we heard from industry, from laboratories, those that have the exact same problem. How can we come together and work towards a solution? And with the output of that hemp task group, NSF International established definitions for hemp-based ingredients, again, informed by and aligned with the output of that hemp task group. And so another triangle, but this one's upside down. So this is the output of a lot of that work. And you're not meant to be able to read the text. I know that it's small. This image, I really just kind of wanted to show you the approach and how we address that. Okay, you've got hemp seed and then you've got CBD isolate. What about everything else? And we noticed, like I mentioned earlier, people were saying hemp and CBD and talking about them interchangeably. As we were doing more research on hemp and how people were talking about hemp, what full spectrum meant, what broad spectrum meant, depended on who you were talking to. And so I'll dive in a little deeper to the triangle. So at the top of the triangle are the less processed hemp components. I won't read into all of these, and I'm happy to share the comprehensive list of these definitions to anyone that's interested. But at a high level, these are the hemp-based ingredients. And again, emphasizing hemp, that we feel have a place in dietary supplements. There is a limit to how much they're processed, how much of that hemp has been removed from the extract, and the composition of that extract not being identical to CBD. And at the bottom is kind of our most processed extract here. And this was definitely a tricky one, and in anticipation of a question of where the 70% came from, because that does come up often. We identified a publication from the European Medicines Agency that spoke to a level of refinement where a critical threshold is generally considered to be above 70% of active constituent, and using that to differentiate isolate versus an extract. And so moving to the bottom of the pyramid, this is what we are saying is what's meant by CBD can't be added to a food or dietary supplement. And so these two types of ingredients, again, those that have a standardized constituent above 70% of the processed extract, and of course, CBD isolate. And again, following on what Ricardo mentioned, as part of the eligibility, there is a promotion and labeling claim requirement. FTC has been very disciplined, especially in the state that we're in a pandemic, and screening websites and writing warning letters based on the promotion and labeling of websites. And so in accordance with that, again, structure function claims that are substantiated are eligible, ensuring that the THC content meets the definition of hemp. What's not eligible, claims that imply an effect on disease, including those that diagnose, treat, cure, or prevent any disease. Also importantly, FTC has targeted TH-free claims. And so in analytical chemistry, you can't say the word zero because we can't prove zero. And so that's absolutely a claim that is not permissible. And of course, it is not permissible to claim pure CBD or CBD isolate. So the second criteria for eligibility is reasonably expected to be safe. And my colleague Brad gave an excellent and comprehensive presentation earlier today on his approach to derive an allowable daily intake for CBD. So when we were faced with this, we did pick up the phone and call Brad, and he was incredibly helpful. And we are using that conclusion from Brad's assessment to set that ADI for eligibility to our certification program. And that is outlined here, that 20 milligrams per day when used no longer than 90 days, and for chronic use, 2 milligrams per day. So in summary, two really big components to hemp eligibility. The first being that it makes CBD content claims only when it's full spectrum hemp or broad spectrum hemp and hemp standardized extract. And of course, these products that are standardized to CBD do not exceed those upper safety limits. And a couple of examples of labels just to drive the point home. Here we have a supplement facts panels. That is a good example of what we are looking for in our certification program. So this product is formulated with a full spectrum hemp extract. That CBD content claim, it is standardized, but it does not exceed upper safety limits. Of course, it has that use of no longer than 90 days. And this little excerpt, of course, does not make drug claims. And finally, don't. So this is an example of those criteria that are not eligible for our program. Formulating with a CBD isolate, exceeding that upper safety limit, and implying daily use without specifying duration of use, and of course, can't make those drug claims. Okay, that is all for me. Thank you very much.